Hi, I'm Charlie Cotner, and I'm here to give you a little bit of information about palliative care and advanced directive. Palliative care is any form of medical care or treatment that concentrates on reducing the severity of a disease. Goals of palliative care are symptom relief, counseling, spiritual guidance, and understanding of treatment or symptoms. Palliative care works with the care providers who are trying to cure your illness. Patients are not required to give up their original physician or treatment, and especially not giving up on finding a cure. Diseases that benefit from palliative care can be cancer, chronic lung disease, AIDS, multiple sclerosis, and that's just to name a few. The main goal of palliative care is to improve quality of life. Not only does the illness itself cause symptoms, but so do the treatments. For example, cancer treatment is chemotherapy, and oftentimes chemotherapy comes with some pretty harsh symptoms or ailments. These include nausea, vomiting, hair loss, dietary issues, stomach problems, sweating, trouble sleeping. All of these things can be addressed with palliative care. Palliative care is a growing industry. Doctors are being specifically trained to deal in palliative care and to help people through their illnesses and keep them as comfortable and as symptom-free as possible. Symptoms that may be alleviated through palliative care include pain, nausea, vomiting, diarrhea, labored breathing. Labored breathing is a big one, especially in respiratory care. Chronic lung disease patients, they deal with labored breathing for a long time, and things that can help alleviate that are supplemental oxygen or therapies, simple things that we take for granted, such as breathing and being able to walk to the mailbox without getting out of breath, are things that these people who are dealing with diseases and illnesses deal with on a daily basis. Other symptoms, depression. I can only imagine the amount of stress and things that are on a person when they are dealing with a disease. Not only them, but their family members can also benefit from palliative care. Counseling and therapy as a family especially could be beneficial for those going through serious, life-changing diseases and illnesses. Weakness and weight loss. I talked about weight loss because that oftentimes can be associated with both cancer and AIDS. AIDS is a wasting, debilitating disease, especially in its later stages. And so dealing with that through dietary help and nutritionalists, people who deal with things like that on a daily basis, can be extremely beneficial to quality of life for a person. Therapies that may be implemented through palliative care, I've already mentioned a few of them, but pain management, counseling, and pain medications. Every disease carries pain, and that can really lead to other things. If you're dealing with pain on a daily basis, I can't imagine that would be good for your depression or for your dietary issues. You know, many people who, when they're in pain, they try to supplement that pain and try to cover it up by doing other things that can be way more harmful for their bodies. So that's where somebody who deals in palliative care can be very helpful. Another thing is that I've already mentioned is dietary suggestions and meal planning. That's especially important for people who maybe have a hard time dealing with their disease and making changes in their life, especially as we become adults. We get so set in our ways that sometimes we're not willing to make changes, even though they could drastically benefit us as we're dealing with disease or illness. supplemental oxygen, I've already covered that with chronic lung disease, and even other ones, cancer, AIDS, all of those things, multiple sclerosis, all of those things could cause you to have problems with your lungs and breathing. Exercise. Things that we as healthy people take for granted are being able to walk to the mailbox, or being able to pick up our children or grandchildren. And exercise, however little it may seem, can help us to be able to do those things again, or to keep our muscles and everything in good condition to be able to do those things. I read several things on the internet dealing with disease that people have found that yoga is beneficial to them both in mind, body, and spirit. So that kind of covers a lot of the things in palliative care. If the illness does progress and you decide that you would like to stop trying for a cure, then your palliative care would turn into hospice, which is more of a 24-hour caregiver that comes to your home, or you move to a facility that's specifically for that and kind of transitions you to your final days. Palliative care is not just for the elderly. Palliative care can be for children. As sad and as much as we don't want to talk about it, children get sick too. I also want to say that palliative care is not just for a terminal illness. It can be anybody who's dealing with an illness that's life-changing, where you have to make adjustments to your everyday living. Quick topic that I'm going to talk about is advanced directives. Advanced directives, that's a legal document that a person fills out, and they fill it out with someone in mind that they want to make medical decisions for them in the case that they cannot do that for themselves. This could be a family member, this could be a friend that you trust, but this is a legal document. The document is specific to each state. It covers quality of life, treatment instructions, organ donation. It covers a wide variety of things in between that. An advancce directive, you decide what person you want to speak on your behalf in case you're incapable of doing so. And then you could either have the document notarized or witnessed by two people. Those two people cannot be your agent. One of them cannot be related to you in any way, whether it be marriage, adoption, blood. And that person can also, they should not be inheriting anything from you, so they cannot benefit in any way from your death. Things that extend life that maybe we don't think about, but that many people who have advanced directives do not want in the event that it's necessary, are CPR, mechanical ventilation. I know one that I didn't think of as life support is nutritional and hydration assistance. I didn't think about the fact that a feeding tube is in essence keeping me alive. So that's one that I didn't know of, but that is addressed in a advanced directive, as well as dialysis. I didn't think about that, but many people who come to that end of life, they don't want any sort of life-saving or sustaining measures done for them. All of those things can be refused or limited depending on what is stated in an advanced directive. And there are many types of advanced directives, whether it be a living will or a DNR. The purpose of both palliative care and advanced directives is to improve quality of life and take control of your care. So I highly recommend to anyone who is dealing with an illness to take into consideration getting some palliative care both for you and for your family, and definitely filling out an advanced directive so that you take control of your illness and your body and your life. Thank you.